Welcome back, East Texas. We're joined now by Dr. Klein with Christus. Trinity, Mother Francis, thank you so much for being here this Wednesday.
Thank you for having me.
Absolutely. So I understand we're talking about a certain procedure today and kind of a science behind it. Tell me a little bit about what it is.
Absolutely. So we're going to talk about orthobiologics, which are kind of a newer type of procedure that's out. And what we're trying to focus on is just give our patients another non-operative option. And just to basically harness the body's own immune response and healing response and take that out and basically inject it into sites of tissue injury.
So why would people want this non-operative version?
Well, it's just another, so there's many non-operative approaches that we take to musculoskeletal medicine. Physical therapy is one. We do different types of cortisone injections, physical therapy we mentioned. So I think it's just another way for people to avoid surgery. So surgery can be expensive. There's the anesthesia costs. There's the the facility fees, and so it's just another way to try to avoid that for patients.
So injections are kind of becoming more and more popular. Tell me about platelet-rich plasma injections specifically.
Good question. So platelet-rich plasma injections, or PRP injections, are basically using the body's own platelets to inject into a site of tissue injury. So platelets are a component of blood. So blood is basically composed of three products: white blood cells, red blood cells, and platelets. So platelets are the part of the blood that actually contain the alpha granules, which actually are the part of platelets which contain the growth factors. So these injections theoretically will help heal injured tissue by injecting those growth factors into areas of tissue injury.
So what could you expect on the day of these procedures?
Good question. So on the day of the procedure, typically the patient comes in, we actually draw the blood from their vein. That blood is spun out with a centrifuge. The platelets are separated out based on their density, and they are then taken from the centrifuge and injected into the site of tissue injury, typically by a guidance mechanism, typically in our case by an ultrasound machine, to ensure adequate needle placement.
So everyone wants to know the results, right? When you're trying to decide what's the best fit for you, you want the quickest recovery time, cheapest procedure. What does this one kind of measure out to be?
Sure. So results we're getting, initial results are great. So what I tell most patients if they're looking at doing these injections is often patients will experience some relief within a week or two post-injection. Most patients, we tell 6-8 weeks they should be experiencing some pain relief. So I tell patients to give this some time. So typically when we do these injections, we do them in conjunction with physical therapy. So we're working with a physical therapist to optimize strength and function while the tissue is healing.
So where can people find more information about orthobiologics?
Sure, yeah, so you can call us at 606-DOCS, or you can go to our website, and there's tons of information about the actual procedures itself, and if you need a call and schedule an appointment, we're up at the Grande location at 110 in Grande. We have a clinic up by the Green Acres Baptist Church, just north of Green Acres.
All right, thank you, Dr. Klein, so much for being here today.
Thank you for having me.
Absolutely.